name is Evelina Kozubovska, and I'm a young Gasteiner, and today I'll be discussing with Małgorzata Bogusz, a rapporteur of the European Economic and Social Committee's opinion on Europe's Beating Cancer Plan, the challenges and the opportunities of implementing this ambitious plan to beat cancer in Europe. Today, Europe accounts for a quarter of the world cancer cases, and therefore, Europe's Beating Cancer Plan is a highly welcomed milestone in the fight against this devastating disease. So Małgorzata, the plan was published almost a year ago, and there is no doubt that it represents a great opportunity for cancer patients in the EU. As a rapporteur of the European Economic and Social Committee's opinion, could you please tell us, what do you think? Does the plan balances adequately aspects that affect cancer patients and survivors? And what, in your view, what are the key actions that now member states and the Commission should take to successfully implement the cancer plan?
I was really delighted and honored to be appointed as a rapporteur of European Economic and Social Committee for the opinion on Europe's Beating Cancer Plan. Actually, I was invited for being a rapporteur for this opinion also with Milena Angelova, my friend from Bulgaria, so also from the CEE region. And this is the most important part which we are focusing in our opinion. It regards the inequalities in member states, and especially in regions. And of course, from my private point of view, it's especially covered the CEE region. I will say that the necessity to implement an effective and innovative Europe's Beating Cancer Plan has been greatly amplified by the coronavirus pandemic. In 2020 alone, 2,700,000 persons living across the EU were diagnosed with cancer, and a further 1,300,000 Europeans died from cancer. A new cancer strategy is needed also because the previous comprehensive European Cancer Action Plan dates back to early 90s. Since then, cancer treatment has seen major progress, notably via support of research and development financed from EU budget. We are thus dealing with the first strategic document in 30 years, which sets the course of the fight against cancer. However, the proposed set out in the plan, it's too general. And we many times were saying that that's the point the European Commission should focus on. Accordingly, the European Commission should be invited to describe how the plan will be translated into concrete action and impact prevention on patient situation. It is necessary to create a roadmap that would detail the implementation of the plan and incorporate performance indicators and realistic timeframes from this strategy. A definite advantage of the plan, which deserves recognition, it is multi-phase and innovative approach to tackling the cancer. This approach is based on prevention, early detection, diagnosis and treatment, as well as improving the quality of life of cancer patients and survivors. While the prevention of cancer is crucial, it is equally important for the EU and member states to ensure the availability of high-quality healthcare infrastructure, including screening, diagnosis and treatment facilities and health services. Such a wide-ranging approach needs to be further adapted to facilitate the equal involvement of all member states and regions to help bridge any possible inequalities. First, the recommendations of EU Beating Cancer Plan should be adjusted to involvement of individual member states and also their capabilities to finance the fight with the cancer. And second, the problem of social inequalities in health must be also addressed. What we would like to stress and what we stress, and I would like to stress, is that cancer is highly unequal disease. So special attention should be devoted to tackling the cancer issue in the plan. This is all the more important as morbidity and mortality are correlated not only with the type of cancer, but also with the social gradients and location.
Thank you very much, Małgorzata. That's really great insights. Many stakeholders stress that the funding will be key in the successful rollout and implementation of the Europe's Beating Cancer Plan. In the European Economic and Social Committee's opinion on the cancer plan, you call for a new Marshall Plan for oncology, outlining that the 4 billion euro in funding has to be reviewed against the backdrop of national health systems. Could you please elaborate on this and explain how the EU can ensure that the most effective use of the resources to achieve the objectives of this plan?
Well, and again, I will come back to the situation regarding the COVID pandemic. We live in the world right now of interconnected vessels. The public sector alone will not solve all the problems. Private enterprises also play a central role in developing solutions for the prevention, screening, diagnosis, and treatment of cancer. For the EU to succeed in the fight against cancer, it is crucial to develop and improve innovation ecosystems. These ecosystems need to involve enterprises of different sizes, from big international companies to startups. Of course, researchers, patients, health professionals, HTA experts, and authorities. This work has to be supported by EU and also national funding, particularly through partnership under Horizon Europe. We should remember about that. Private enterprises' contribution to fight against cancer is all the greater because they not only develop and provide medicines, vaccines, technology, and care services, but also strive to beat cancer by reducing the environmental impacts, developing and producing safe products, and improving health and safety in the workplaces. To reduce inequalities in beating cancer and to provide high standard solutions for all, it is crucial for the EU to encourage solid cooperation between member states. Also about the financing, and also not only about the member states, but also the regions in EU countries. This is extremely important, especially in the field of research and development, as well as education. The Union should also ensure and encase a well-functioning single market of currency-related goods, services, data, and labor. You know, only joint efforts at the EU level and the cooperation between the member states can bring tangible benefits to fight against cancer. Well, I will say that thanks to the Europe's Beating Cancer Plan, we have a tremendous opportunity to safeguard the health needs of Europeans. The plan should take into account many different implications of cancer incidents. This applies above all of the demographic and economic issues I've already mentioned before. We cannot afford to remain neglectful in the fight against cancer, which would generate human suffering and worsen the economic conditions of Europeans. A failure to act will create a snowball effect, like I said many times, a cancer tsunami, leading to the accumulation of problems that could get out in hand into no time. This is a very urgent problem. There are many elements we need to come together to dispel any doubts about the prospect of effective implementation of the Europe's Beating Cancer Plan. The general and unfortunately non-binding nature of plan does not guarantee its effective implementation and a more effective and regionalized response to the increasing incidence of cancer. Accordingly, one should call for the elaboration of a variety of different instruments that will pave the way for the successful implementations as much needed strategy. Social partners and civil society organizations, which I personally presented, they are key actors of this fight. I will say that all of these actors should become involved in the further development and follow-up of Europe's Beating Cancer Plan, especially patient advocacy group, especially private sector, especially big pharma industry. They are the main actors on the scene. We should remember about them. What I'm, saying always is, and this is what came from your question, is that European Union really needs a Marshall Plan for the oncology. I will repeat it until the Europe's Beating Cancer Plan becomes a fact, actually. And I think that this program, this document, even non-binding one, is a great step in the very right direction. But we, as a European Union, as a European Union institutions, we must not waste this potential.